watching Let's Chat.
Welcome back to Let's Chat. This morning we are talking a little bit about breast cancer and specifically those who may be considered high risk. We're going to talk about what that is and what we need to know with the help of Miss Casey Waddle. Good morning.
Good morning.
Thanks for joining us.
Thank you for having me.
So you're a nurse practitioner at CHI Memorial's Breast Cancer Associates Center, which is within, of course, the Mary Ellen Locher Breast Cancer Center.
Yes.
So tell us a little bit about your day-to-day life.
So I work with the CHI Memorial Breast Care Associates. I work with the breast surgeons there. I work, I do follow-up, see new diagnosis patients, but we also have this high-risk breast clinic in that we see high-risk patients who may be considered high-risk, don't know their risk, patients that are predisposed to breast cancer based on their genetics. So we see those patients more frequently. They can be screened twice a year. They can be seen twice a year with bedside exams, and they can even be seen, they can even get increased imaging. So on top of their once-a-year mammogram, they can also get once-a-year MRIs.
Okay.
So the whole idea being, if something were to come up, we would catch it early. So that's the whole premise behind the high-risk
I think
clinic.
a lot of people don't realize that CHI has a high-risk clinic that, with a staff that focuses specifically on this group of ladies. I want to talk about why it's so important for someone to know if they're considered high risk and how we get to that point as well.
Well, and you're exactly right, a lot of people don't know this exists, and it's so important because early detection is key. We have started reaching out to primary cares, trying to let them know that this does in fact exist. We're trying on the front end at the time of screening mammograms, trying to let these women know, oh, you might be considered a higher risk based on your breast density. Women with a breast density of a 4, which is the highest breast density that there is, sometimes that increases their risk. That and a family history with a first-degree relative with a breast cancer, that in and of itself can increase your risk.
Absolutely.
So those two things alone can put you in our high-risk clinic, and a lot of women don't know that.
So you mentioned some of the benefits are, of course, the more frequency of the visits, of course, the enhanced imaging. What else would you say is a benefit of the clinic?
A lot of our women just like the idea of somebody following them.
Right.
Just the idea of somebody being there to follow them more frequently, and just knowing that somebody's there. Some women, just want to be seen more frequently for their anxiety. Some women, want to come in, and we also, follow in conjunction with gynecology visits. So if they're still seeing their gynecologist, they're getting screened 3 times a year. Because they're still seeing their gynecologist, and their gynecologist will typically do a breast exam, but we'll still see them twice a year also. So they're still getting, that's 3 breast exams. And like I said, the whole idea is that, if something were to come up, we're going to catch it early.
And if you're high risk, I don't think you can have too many, that's for certain.
No.
And so you've recently expanded. You have 2 locations now, Etowah and, of course, in Chattanooga and down a couple areas.
We see patients at many locations. So we are still at Glenwood, main Memorial location at the main Mary Ellen Locher. We see patients in Hickson. We see patients in North Georgia.
And we can find all locations online.
Yes.
Is that correct?
Yes, absolutely.
So if we think we might be high risk, or maybe we don't know, how do we need to get started?
You can call our office and just schedule an appointment. Say, hey, I'm just not sure, and I just think I'd like to talk to somebody. And can I schedule a high risk appointment? And insurance, you don't have to have a referral from PCP. You just can say, hey, I just would like to schedule an appointment. So
Casey, thanks for joining us so much.
Thanks.
All right, we got to run.
Oh, okay, bye.